Hello friends, your INI CET exam is over now. You have finally performed in the exam and now your next target is NEET PG. So we can analyze what is your mistake in this exam so that you can improve in the next NEET PG exam. If you are coming to this channel for the first time, then subscribe my channel for more such pharmacology related videos. So this is the exam recall session on pharmacology. So let us begin. Paper analysis of INI CET exam. This was based on the candidates review regarding the INI CET exam. Most of the candidates found the difficulty level of the questions moderate to difficult. The questions in the INI CET exams were from preclinical, clinical integration, matching type, assertion, reasoning, single correct and multiple correct answer type of the questions. So these type of the questions were asked in May 2026 of INICET. Then image-based questions were asked from dermatology, histopathology, MRI scans and USG. And pharmacology, most of the questions were concept-based and some of the direct factual recall and integrated with the other subject. That type of the questions were asked from pharmacology. Very close options were provided, so the elimination method to solve the paper did not work. One of the most important thing in INICET exam is strategic time management, because you are provided with the 4 sections and that you have to finish within 45 minutes. So that really require practice. What are the last resort revision strategy and exam hall strategy? That video I have already uploaded, that you can watch, and the link for that is in the description box. Most of the questions resemble the previous year's questions, but with the little twist and change in the answer options. And this year, gynae questions were more as per the students' recall, and around 100 to 120 questions were from the PYQ papers. So that is the reason you must solve at least PYQ papers. Around 40 new questions were asked in this exam. Let us do the sectional analysis of the paper. So section A, anatomy and physiology. Section B, more of the questions were from the microbiology, and section C and D, these were from the clinical based topics. So this is about the brief paper analysis of the INICET May exam. Now let us begin pharmacology recall sessions, which were the questions asked in the INICET 2026. First question is, lamotrigine is a drug of choice for myoclonic absence, tonic, clonic and atonic. So answer here is a tonic, clonic. So very easy question. Let's move to the second question. All are ligand gated receptors except. So H2, 5-HT3, GABA A and nicotinic. So answer is H2 receptor. All these others are the ligand gated receptors. 5-HT3, GABA A and nicotinic. These are ligand gated receptors, and H2 receptor is not ligand gated receptors. Which of the following receptor is coupled to GS protein? So options are alpha, beta, muscarinic, M1 and M2 type. So answer here will be beta receptor. Alpha receptor is a GI type of the receptor, inhibitory type of the receptor. Beta is stimulatory and it is coupled with the GS protein. So here the answer will be beta receptor. Mechanism of action of pretomanid: mycolic acid synthesis inhibitor, RNA polymerase inhibitor, ATP synthesis inhibitor and arabinogalactan inhibitor. So answer here is a mycolic acid synthesis inhibitor. This I have already covered in my previous video. Most expected antibiotics and antiviral INICET exam part 3 that you can watch. So this is very easy question. Many drugs are mycolic acid synthesis inhibitor. So this was the mnemonic I had given in that video. So this was also very easy question. A child diagnosed with the Dravet syndrome was on multi-drug therapy added with the fenfluramine. Which of the following statement is correct? Eye examination every month to evaluate peripheral field defects, cardiac evaluation for valvular heart disease and pulmonary hypertension, CBC once a month to evaluate leukopenia and aplastic anemia, liver function test every 3 months. Fenfluramine, the major side effect is valvular heart disease and pulmonary hypertension. So answer here will be cardiac evaluation for the valvular heart disease and pulmonary hypertension. Resmetirom mechanism of action, which is used in a MASH, that is metabolic associated steatohepatitis. Options are inhibition of the lipoprotein lipase, decrease in the cholesterol synthesis, agonist of the thyroid hormone receptor beta, and inhibits the cholesterol synthesis. So answer here is agonist of the thyroid hormone receptor beta. So this is the correct answer. Rest of the options are not true. Which of the following is classified as a novel antidepressant with the multimodal activity? So the novel antidepressant is vilazodone. That is the answer. Blonanserin, itizolam, trazodone. These are the wrong options. Vilazodone is a SPARI, serotonin partial agonist and reuptake inhibitor. So that is the novel antidepressant. Blonanserin is an antipsychotic drug. Trazodone is also antidepressant, but it is not a novel antidepressant. Which of the following is the correct statement for ticagrelor? It acts by P2Y12 inhibition. That is true. Intracranial bleeding less than clopidogrel. Need metabolic activation in the liver, and it is a reversible drug. So this is a multiple correct answer type of the question, and here two options are correct. One is it acts by P2Y12 inhibition, and another is it is a reversible drug. So two options are correct here. Now, clinidipine does not causes reflex tachycardia due to which type of calcium channel inhibition? L type, T type, R type, N type. Answer here is a N type. So remember, clinidipine acts on the N type of the calcium channel. N stands for nerve. So clinidipine acts on the N type of the calcium channel, and it decreases the sympathetic transmission of the norepinephrine, and that is the reason it causes less reflex tachycardia. Which antibiotic is a concentration dependent killer? Aminoglycoside, beta-lactam, linezolid, and vancomycin. Answer here is aminoglycoside. Very easy question. What is the drug of choice for catalase positive, gram positive, cluster sensitive to cefoxitin and oxacillin? Gram positive, cluster sensitive. So that means Staphylococcus aureus. Methicillin sensitive, Staphylococcus aureus. So here answer will be cloxacillin. Rest of the options are not correct. Choose correctly matched pair for following anti-cancer drug. So sunitinib HER1, trastuzumab HER2, zaftinib HER1, nilotinib BCR-ABL, and TK1. So from the given options, sunitinib does not act on the HER1, it acts on the PGFR and VEGFR. So that is not provided here. Option A is incorrect. Rest of the options are true. So answer here is a B, C, D options are correct. Now choose correctly matched pair for drug sensitive organism. Clarithromycin, H. pylori, streptomycin, MDR-TB, amoxicillin, gonococci, doxycycline, chlamydia. Here only two options are correct. Clarithromycin for H. pylori and doxycycline for chlamydia. If you found this video helpful, then subscribe my channel, and in the next part we will discuss about some of the image based and graph based pharmacology questions which were asked in INI CET exam. Thank you for watching.